Hello and welcome to Adelante Chicago. I'm Ana Belaval. Thank you so much for joining us today. Illinois is seeing an increase in respiratory illness, which was expected after the holidays. Viruses like COVID-19, influenza, and RSV are sending more people to the doctor's office. The Department of Public Health says those infections are now at a high level statewide. So what can we do to protect ourselves? Dr. Juanita Mora is here to give some suggestions. Thank you so much for being here, Dr. Mora.
Thank you for having me to speak on such important information to give our public.
Is it, when we live in this climate, we know that this is going to happen this time of year. It's the sneezing season. Is it extremely high compared to other years?
Well, yes, this is basically the second largest wave of COVID-19 that we've had since the original Omicron, Ana, which means that CDC is expecting 100 million people infected with COVID-19 in the U.S. That's 1 in 3 people. And this is why it's time to talk precautions, especially as masks are coming back to the healthcare systems. But what about our most vulnerable? How do we protect them? Is it time for them to mask as well, too, especially in indoor settings where we have a lot of people? You, for example, church gatherings, supermarkets, basketball games, or any concerts, or any large indoor gatherings.
So we're talking 65 and older?
Well, or anyone immunocompromised as well, too, because, you know, obviously they're going to be higher risk for COVID-19 complications.
What strain of COVID-19 is this?
JN1 is what it's called.
Is that new?
So it is basically a subvariant of the original Omicron. So it's very transmissible, but thank goodness it's not more mortal, which is a really good thing. But it's sending a lot of people into the hospital that we are seeing currently. And so we have an increase in hospitalization and an increase in number of infections. That's how the CDC is measuring in the residual waters, where they're seeing a very, very high level of COVID-19 infections.
Dr. Mora, a lot of us have home tests, home kits that have been there for a while. Can we still use them, and are they effective to test for that variant?
JN1 is currently being tested on the rapid COVID test. People can still get it through the government for free as well, too, 4 of the little tests that can be mailed to their home. And if they are already expired, FDA has allowed a 6-month extension on the expired COVID-19.
6 months.
6 months.
Okay, so if it's past due, you still have 6 months from that date.
Correct.
Perfect. You're saying mask those people, but let's talk about vaccination. Before Christmas, you were also very concerned that people weren't vaccinating not only for COVID, against COVID, but the flu and RSV. Is it still that way? It's
very low vaccination rates. We're talking about 48% for flu, which is usually higher for vaccination rate. We're only talking 20% for COVID-19. And for RSV, because it's a newer vaccine, it's actually lower than that. It's about 17%. So this is a time, people ask me, is it too late now to get the vaccines? Absolutely not. Go get your COVID-19 vaccine. This is going to be like an annual vaccine we're going to have to take, because COVID's changing. So guess what? Our vaccine has to change as well, too, in order to cover us. Flu vaccine, annual vaccine, everyone 6 months and over. COVID-19, everyone 6 months and over. RSV, pregnant women and people over 60 years of age, and babies 0 to 8 months, and then those 8 to 19 months who are high risk for RSV complications.
RSV is 1 shot?
RSV is 1 shot.
And so is COVID. No more booster situation.
No.
Can you get them all at the same time?
Well, CDC is recommending flu and COVID-19 that can be given at the same time. And the RSV, at least space it a week apart, just to minimize the amount of side effects and pushing of the immune system as well, too.
This is happening nationwide. So it's not necessarily, is it worse for those of us who live in states that have, you know, winters that are this harsh, that we all have to be inside because it's cold, or is it happening in other states where it's warmer as well?
It's happening in states
you know how
like
Latinos
Florida.
think that cold weather makes us sick is what I'm trying to ask you.
No, it's happening everywhere, because everywhere it's a little colder. Even in Florida, it's a little colder in the morning. So gatherings are going indoors as well, too. Poor ventilation and lots of circulation of these viruses, and people are traveling left and right. And we're coming out of Christmas gatherings and New Year's gatherings as well, too.
What are we seeing in our community? I know you're very active when it comes to providing access to the vaccines and creating awareness when it comes to our community. How are we seeing those numbers when it comes to flu, RSV, and COVID in the Latino community?
Well, because we're a tight-knit community that loves their gatherings as well, too, we're seeing a high number of cases of COVID-19, flu, and RSV. Post-Christmas gatherings, I saw many kids and adults infected with flu, COVID-19, and RSV. Now I'm seeing the post-New Year's gatherings, and I honestly, this morning in clinic, I probably saw 10 cases of COVID, plus 2 of the flu.
Excuse me, what?
I'm mad,
Excuse me,
Gana.
what? I know you do. You are a superwoman, I do have to say. So wait, I don't want to let you go until we tell people how they can find those vaccines, especially for free. How are they accessible for our community?
Absolutely. So the city of Chicago has actual vaccine clinics that happen every Saturday here in the city of Chicago and throughout different parts, different universities, where people can go from 9 a.m. to 2 p.m., sign up. They can get flu vaccine and COVID-19 vaccines completely for free. Then they're running other clinics for RSV vaccines as well, too. And then in their pharmacies, they can ask, especially if they don't have insurance, about their bridge programs.
Got it.
Because so that the way they can get it for free, because the government is providing a bridge program for free vaccinations within the pharmacies as well.
Do you know where they can find that information? Is it a Google search? Is it 311? Where can they find out?
For the city of Chicago, just go on their website for cityofchicago.org.
Do they need an appointment?
Well,
I needed an appointment at the pharmacy.
For the most part, it's better to get an appointment
Gotcha.
rather than just walk in, just so that it's not so busy and you're in and out.
Safe. They're safe. The vaccines are safe.
Vaccines are super safe, they're super effective, and they are here to protect us. It doesn't mean you're not going to get COVID,
Right.
but if you get COVID, you're not going to get as sick, you're not going to be hospitalized, and you're going to be able to enjoy the holidays and these post-holiday gatherings as well, too.
Thank you so much, Dr. Mora, for being with us and giving us such wonderful information as always.
Always a pleasure.
Likewise, Dr. Juanita Mora.